Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. We've had a couple of good weeks in this province with a streak of no new cases. I want to thank all Nova Scotians for committing to the public health protocols. It's because of your effort and your willingness to wear a mask, keep your distance, and follow proper hand hygiene that we have managed to flatten the curve. Today, though, we are reporting one new case of COVID-19. It is an essential worker connected to travel, and Dr. Strang will have more details. But it is evident that COVID can creep back in, and we need to be very careful. That is why we doubled down on a rigorous testing strategy for post-secondary students coming into our province from outside of the bubble, and I am proud to say that strategy worked. Thank you to our institutions and our student leaders who worked so hard to implement this strategy. I know it wasn't easy to mandate a 14-day quarantine in residence where young people would normally socialize and I dare say party a bit, but you all did it, and we as a province are grateful. With this testing strategy complete, we now need to redouble our efforts on public schools, and we are doing that. And I know this hasn't been easy on teachers and principals, but you are doing great, and you might not always feel that way, but I am really proud of what you are doing. Keep it up, and thank you on behalf of all Nova Scotians. Now we have some good news for residents of long-term care and their families. We are easing some more restrictions and to allow residents to get out, to visit their families in their homes. It's a freedom that you enjoyed prior to COVID-19, and it's not something that we enjoyed taking from you, but we are happy to give it back. But let's be clear, a second wave of COVID is coming, and if we see a spike in cases or any sign of an outbreak, we will have to revisit those restrictions. So to all the families who are anxious to bring their loved ones home for a visit, please continue to follow the protocols. Dr. Strang, over to you.
Thank you, Premier. Good afternoon, everybody. So I'll start today, as I always do, giving an update on our cases here in Nova Scotia. As the Premier said, we are announcing one new case of COVID-19. This is an individual in the Nova Scotia Health Authority Western Zone, and the individual has recently traveled outside of Canada. This case is under active investigation still by Public Health, but it certainly appears that this individual had very few close contacts, which is good news. So to date, we've had 1,087 cases of COVID-19 in total. 88,459 Nova Scotians have been tested with negative results, and we've had 65 deaths, unfortunately. And testing continues, and yesterday the Nova Scotia Health Authority's lab completed 681 tests. Over the past number of weeks, we've had nearly 4,000 students who entered Nova Scotia from outside Atlantic Canada to attend one of our universities or Nova Scotia Community College. They arrived in the province with their self-isolation plans, and about 89% have now completed that self-isolation. More than 94% of them complied with the daily digital check-in. And we have also in total done 8,826 tests of these over 4,000 students. We tested students up to 3 times, and as we explained at the start of this, the reason we did this was we're bringing in a large number of students within a short period of time and putting these 3 measures of having to have an isolation plan with daily digital check-in supports from universities and communities and the testing were what we felt was necessary to allow to bring this large number of students in and keep them, their university campuses and their community safe, and it's worked. We're now in the place where our universities are opening up classes, some of them virtually, some of them in person, and we have had really no increase in COVID-19. In fact, with our testing, we had 1 true positive, and we had 3 that we were treating as a positive out of an abundance of caution. As you remember me talking about, some cases can be what we call indeterminate, but we are the ones that we thought could could be a new case, we treated them like a new case, even though we weren't sure, erred on the side of caution. So 1 true and 3 probable cases out of over 4,000 students who were testing. And the fact that we were doing the testing, and the ones who tested positive had further isolation and restriction of their social activities. So I certainly consider that our approach to the universities has been a significant success. And I want to thank the universities and the Nova Scotia community colleges, the administrators for their efforts in all the planning that went on to the safe return to school. I want to thank the communities that supported the students, and most importantly, I want to thank the students for understanding the importance that we were welcoming them into our communities, but they needed to take the safe community seriously, and they have. And because of that, we now have, as I said, classes are underway at all our universities. We now have, there's a few students still coming in. Any of them arriving now from outside Atlantic Canada will still need to comply with the 14-day isolation period, just like anybody else coming in from outside of the Atlantic bubble. So to finish the testing on students who have recently arrived, we're going to continue with the on-campus testing sites until October 5th, and then they will be closed down. But please be reassured that working with the Nova Scotia Health Authority, there's still very ready access to testing throughout the school year if any students become symptomatic. But we're going to be shifting our emphasis now and the resources around the university testing back into our 26 primary assessment centers that are spread around the province. I want to clarify a few points about self-isolation requirements that keep coming up. So if you live with somebody who has been told they need to self-isolate because they've screened in and are waiting for test results, it's important to understand that person who's waiting for their test result has to isolate, but anybody else in that household does not need to isolate. They can still go about their activities, go shopping, go to work, go to school, etc. We keep hearing lots of stories about people saying, well, now my child is home waiting for the test result, I can't go to work. That's not true. The individual that's been screened in and is waiting for a test appointment or for a test result has to stay isolated at home as much as possible. And I recognize that with young children that can be very challenging, but that's why we say as much as possible. Do your very best within a household to keep that individual waiting for their test or their test result, but knowing that they need to be supported and have care provided to them as well. But other people in the home, including the parents or caregivers, do not need to isolate themselves. Of course, everybody should, in that whole household, we want to be monitoring for symptoms, and if any of them become unwell, then they need to then do the 811 online assessment, or calling 811 if they can't do the online assessment, and then take direction from 811. But again, if you're in the same household as somebody who's waiting for a test or a test result, you do not yourself have to isolate. And I emphasize that point because we're getting huge numbers of questions on that, and there's a lot of misunderstanding out there from individuals and some employers even around this. It's just that at this point in time, our epidemiology doesn't support the need for the entire household to self-isolate. But if necessary, we would adjust this if the epidemiology warrants it. So let me move on about the arts and sports gathering limit that was announced on Friday. So as you recall, on Friday we announced that there was a planned increase to the allowable numbers for participants in sports, performing arts, and organized physical activity like open swims and skates. Effective October 1st, up to 50 people can gather for these activities without the need for physical distancing. This change to the order allows for rehearsals and performances to resume for arts, music, and theater, again with a maximum of 50 participants. And included in that 50 are performers along with any directors or other support people required to be backstage or within the performance space. There are some exclusions for higher risk activities. So in particular, singing in groups or playing brass and wind instruments. It's because given what we know about and what we're learning about how COVID-19 is transmitted, it's important that these specific activities continue to be done maintaining the minimum of the 2 meter 6 foot distance. So again, singing in groups and playing brass and wind instruments are not included in this overall number of up to 50 that doesn't have to worry about physical distancing. Those specific activities can happen, although we're recommending that people be very careful about large numbers of people in a choir, for instance, singing together. But if it does happen, they need to maintain the physical distancing. For sport, the limit of 50 includes athletes, referees, and other officials, coaches, instructors, therapists, and anyone else who is required to be on or beside the field of play. And the field of play means the ice surface, the court, or a field. This should allow full team practices, games, and competition play to resume for almost all sports. And this applies to whether it's professional, amateur, or recreational league sports, and applies to all ages. So it can apply, for instance, youth hockey, from recreational hockey to elite hockey, and it also applies for adult recreational leagues as well. However, it does not apply to casual or unorganized sport-specific gatherings like a spontaneous game of pickup basketball or soccer in the park. Given the lack of structure and organizing contacts for these activities, they need to be seen as social gatherings, and therefore they can proceed, but they have to have a maximum of 10 participants without physical distancing. So I acknowledge that there's a big range between a spontaneous game of pickup basketball or to an elite hockey league, and there's lots and lots, and we've had a lot of communication over the weekend about organized groups that have been getting together for, let's say, every Tuesday or Thursday night to play ball hockey for years. And these types of recreational sport activities, they're not governed by a provincial sport organization, so there's no league or club. But because of their organization, there's enough organization that we feel comfortable that they can have up to 50 participants without distancing. But they can happen. They need to have, if there's a predetermined space that they have to rent or book, and there's a consistent group of people. So, again, the example would be a group of, and I've had people within that I work with coming to me about this. They've been playing hockey together 3 times a week, the same group of about 20 people. Somebody's in charge of renting the rink. They get together. It's the same group. Those can happen now, get up to 50 people, because there's enough organization around them that if we did have a case in that group, we'd be able to go to somebody and say, who are all the other people that participated? But it's the spontaneous pickup games, if you will, people just showing up and having an activity, which we're saying has to stick with the level, a maximum number of 10. The gathering limit of 50 also does not apply to fitness facilities or things like yoga studios. They have their own guidelines in place. Once we reopened all these fitness businesses, they fit under the category that they can carry on their business and they can accommodate whatever number that their space allows, as long as physical distancing of 6 feet or more can be maintained at all times. If they cannot do that, then their maximum number is 10. That rule has not changed. So for the fitness business and fitness facilities, the rules remain unchanged. And for people who simply get together for a group activity, and I've had people reaching out to me about this, so they just get together in a house together for things like Tai Chi or yoga. Again, the existing gathering limits will apply. That you could have up to 50 people if everybody can be distanced, and if you can't, then it's up to 10. So these kind of organized or less organized fitness activities, then the existing gathering rules and the existing rules under the public health order for businesses apply. And all the other rules also apply. The masking rules apply. So we require masks in indoor public places except when people are doing physical or other activity where the mask cannot be worn. So certainly, let's take hockey. So when people are going to the rink, they're in the changing room, they need to wear their mask. Once they get out on the ice, they don't have to unless they feel they can wear a mask while they're practicing or playing. Once that activity's done, then they go back to the changing room. The masks need to go back on while they change, and then they leave the rink. Let me finish on this topic by talking about audiences and spectators. So this new capacity for up to 50 without distancing does not, I'll repeat that, does not apply to audiences and spectators. So the gathering limits just discussed about up to 50 requiring physical distance, and people within that, you can have groups of up to 10 who don't have to distance. Those are the ones that the existing rules about gatherings that apply for audience and spectators. We have also making it clear that the audiences and spectators must be in the available seats or stands, and if not, like on the side of a field, they have to be at least 2 meters away from the field of play to distinguish them from sideline coaches and officials. If there is a recognized business or organization holding an event, as you're well aware of, our gathering limits of up to 50% capacity to a maximum of 200 for indoors and 250 maximum for outdoors apply for audiences and spectators. It's unfortunate, but I have to mention that I'm hearing concerning stories from my colleagues in the recreation and sport field. Recent stories of parents who have disregarding both the facility and the public health requirements around maintaining distance, for instance, and wearing masks, and being very disrespectful for the people who work in these facilities. I'll continue to work with sport organizations and facilities, but at the end of the day, people need to understand that watching your children play is a privilege that needs to be respected. And if we cannot have safe environments for spectators, I'm very comfortable saying that we will remove the privilege for adults to watch children play if they cannot behave as adults and respect the rules. Different facilities do have different capacity limits, and therefore different rules apply. So as the October 1st comes closer, I urge people and families to contact the facility which you're expecting your child or you to play in, so you're well aware of what the capacity limits and the specific rules around spectators are for that specific facility. Let me move on to long-term care and community access, as the Premier mentioned. So as the Premier said, we are announcing further loosening of restrictions in long-term care. We know that some residents and families have been wanting to connect in ways that they could before the pandemic. Our approach to restrictions in this sector has been a very phased and careful approach. We heard yesterday around the high risk that long-term care facilities are. And the vulnerable residents in those facilities, and we have to remain very cautious and careful, protecting those most vulnerable in our communities. But we've been watching the epidemiology carefully and making decisions incrementally to relax the restrictions in those facilities, and then allowing time for facilities and families to adapt. So beginning as early as September 28th, residents can now enjoy off-site day visits with family. This means that they can leave their long-term care home for a social visit, say for instance for a Thanksgiving dinner with family members. These off-site visits must be prearranged with the facility, who will maintain a record of these trips, and we are working to develop comprehensive guidance for families of what they need to do to follow during these visits to keep their loved one as safe as possible when they're having these family interactions. And all that information that's very detailed information, will be available for families through facilities. And as I said, like all the previous changes, the individual facilities will now start to work to implement these, considering their own unique situations and their own residents. And the timing of this may vary somewhat. That's why we're saying as early as September 28th, but for some facilities it may take a little longer. And I want to reflect, or end by reflecting that in Atlantic Canada, we remain in a very fortunate position as we still have little to no local COVID transmission. As we're seeing COVID increase in Europe, in the USA, and in other parts of Canada, I want to remind us, all of us, that the way we continue to keep our fortunate position is three key areas. Continuing with appropriate measures for people coming into Nova Scotia from outside of Atlantic Canada, having a very careful, cautious approach there. We need to continue, have the health system focusing on testing and in case and contact follow-up. And thirdly, all Nova Scotians need to continue to care for each other and build safe communities by continuing to practice the personal preventive measures and following the requirements on gathering limits, wearing masks, and social groups. Again, it's by doing all these things that keep us safe, but more importantly, keep those around us safe. Many of us may feel that we're not ourselves vulnerable, very at high risk for COVID, but anybody is at some risk. But we have to understand that individuals around us and our schools around us, our long-term care facilities around us, they're only as safe as we allow them to be safe. So it's our collective responsibility. And it's by doing that is how we're going to keep, as much as we can, our very fortunate and privileged position within Atlantic Canada of being one of the safest places in the world. Premier.
Thank you, Dr. Strang, and Chrissy, over to you.
Just a reminder that we'll take one question and one follow-up in the time that we have for questions today. First, we'll go to Mike Tutton with the Canadian Press.
Minister, just to touch on the situation in southwestern Nova Scotia in the fishery dispute that's going on there. What is your view of Indigenous fishers hauling out the traps of the Indigenous lobster harvesters?
Listen, on all sides of this issue, emotions are running high. Many, for generations, this has been their livelihood. My word to all of them and my commitment to all of them is that, you know, the way to a resolution is through dialogue. That's why I believe the federal government and DFO should have all of the participants, all the partners at the table at once, so we can all hear each other's sides of view to come to a resolution. But the laws in the province apply to all. And I expect those agencies will enforce the law if they believe it's being broken.
The federal ministers have really not, they're leaving it uncertain as to whether what is going on with the lobster fishery is illegal. Given that uncertainty, should the provincial government not act on prosecuting buyers, which is under its jurisdiction?
So there have been, as you know, there was a case not that long ago where a buyer was prosecuted and found guilty. That is the part of this that does fall under the provincial jurisdiction. But when it comes to the issuance of licensing, all of the criteria around the lobster fishery, that is at the federal level. It requires DFO to be at the table with all of the participants in this sector. Everyone needs to understand each other's point of view. And, you know, a conversation with the Indigenous fishermen and then a conversation with non-Indigenous fishermen in separate places, this all needs to come together. And DFO needs to lead this conversation so that we're all in the same, they're in the same room, they can hear each other's point of view, recognizing the law. What does a moderate livelihood mean? Having that conversation with everyone in the room so we can come to what is a solution that provides the stability around this sector and sustainability. I mean, ultimately, that's what we're talking about. Being able to ensure that we respect the treaty rights of the Indigenous community, at the same time ensuring that we provide the sustainability of this fishery. This is a lucrative part of our economy and one that has been managed for generations. And we need to make sure that it is there for generations to come.
Next question will go to CBC's Mike Gorman.
Dr. Strang, you talked about the importance of testing and a robust system as part of keeping our numbers low. Premier, you spoke last week about efforts to bolster 811. We are continuing to hear reports about people either not being able to get through or experiencing very, very long waits. Can either of you please provide some sort of update on what is happening with 811 to try to ensure people are getting through in a timely manner?
So I had a conversation with Minister Delory this morning. The whole health system, a number of people in my department are working actively with the health authority and with 811. They are working hard to hire additional people, but there's also another number of other opportunities that we're looking at in other ways that could facilitate a more efficient and effective way to access testing and getting people tested in a timely manner. We're well aware of some of the challenges. We need to do a better job. It's a key part of our strategy, and there's active work to resolve that.
Go ahead with your follow-up,
Okay,
Mike.
so since you've opened the door, what are those other ways, Dr. Strang?
There's still a number of things that are being looked at that are not ready to be brought forward and talked about publicly yet, but there's a number of things. There's active conversation in the health system about ways that we make this better.
Next question will go to the Herald's John McPhee.
Thank you. Dr. Strang, with the return to school, we've heard concerns and what might be labeled complaints about testing for children who are showing illness of some sort. I mean, there's the people are confused over what might constitute COVID in their child, what might be the flu. What percentage of the people, say, in the latest round of tests, what percentage would it be school-aged children?
So I don't have those numbers in front of me. Certainly, anecdotally, as we decrease the numbers of students we're testing, our numbers have remained high. A lot of those, anecdotally, are going to be children. I don't have an exact number on me on that. But I will comment also that we're not asking people to try to determine themselves whether they're COVID symptoms. The simple message for people is if somebody becomes unwell, whether they're a child or an adult, if they become unwell, they should isolate, go home or stay at home, and then do the 811 online assessment. And that we've modified those screening tools as we announced recently. We've a smaller number of symptoms, but we're comfortable that that's still a very low threshold. If somebody meets those criteria, so it's a new fever, or a new or worsening of a chronic cough, or 2 or more of headache, sore throat, runny nose, congestion, or shortness of breath. If anybody meets any of those criteria, then they are referred on for testing. But again, we're not asking people to memorize that. What we're asking them to understand, if they're unwell, isolate and do the 811 online assessment. If they don't have access to the internet, then they can call 811.
Go ahead with your follow-up, John.
Thank you. This probably changes from day to day, but do we know, like in general, how many people at one time would be waiting for test results?
I don't have that data in front of me. We know that we have a number of people that are waiting, and as we just had the previous question, we're working to minimize that wait. Timely access to testing is an important priority.
Next question will go to All Nova Scotia, Lindsay Armstrong.
Thank you. Dr. Strang, regarding the self-isolation requirements and that clarification you made, say there's a young child who requires care from parent or parents, and you said that that parent is okay to be out and about or at work. What is the situation there in terms of concern for asymptomatic spread in situations where a caregiver may be interacting a great deal and then is required to work with other people?
So that's where it comes into our epidemiology. We know that there is certainly the reality of asymptomatic spread. We do not have any indication, and have not had for many weeks, of any local transmission of COVID. That's why we say the epidemiology is low enough, is that the risk of a household member then continuing to go to work and them transmitting COVID is very, very low. So that's why we're comfortable that the household members don't have to isolate themselves. But that's what I said. If our epidemiology shifts and we have much more COVID around, we would take a much more aggressive approach potentially on these household members. But right now, like everything with COVID, I use the word balance all the time. This is balancing. Having everybody in a household have to isolate until they got a test result back is a substantive imposition and has lots of implications for the family, economics, as well as for businesses and the people in the workforce. So we're at a place right now where we're safe enough with COVID that we can allow household members to continue to be out in the community, even if one person in that household is waiting for a test or a test result.
Go ahead with your follow-up, Lindsay.
Thank you. And then regarding the new case you announced in the essential worker, was this individual self-isolating, or does essential worker mean that they were at work?
They were in one of the criteria that because they're involved in the necessary movement of people and goods across the Nova Scotia border, that they didn't have to self-isolate. But as I said, we're continuing to follow up. But everything we know so far is there's a very small number of close contacts involved in this case, which is good news.
Next question will go to Global's Aya Al-Hakim. Aya, are you there?
Yeah, hi. I have a question in regards to flu shots. Is there a plan or new measures that are going to be put in place to help clinics meet the demand for flu shots while having to follow pandemic precautions?
So we have communicated already and continue to communicate both to pharmacists and our primary care physicians who every year give a flu vaccine, as well as a small percentage is actually given by public health, that everybody's gonna have to run their flu clinics differently. It won't be large mass clinics. It's gonna have to be run on individual appointments, so you can run a clinic and maintain the necessary registration and social distancing that's required as you do the vaccination. So, and then I'm hearing that the pharmacies are already gearing up for this, as our family physicians. So I'm confident that we'll continue to be able to offer a flu vaccine. We're certainly hoping we'll have more Nova Scotians than ever get a flu vaccine, but we can do this, still deliver flu vaccine in these different settings while maintaining COVID safe precautions while we do that. It's really all about keeping people apart from each other, not having long lineups, large groups of people sitting together while we get them through the immunization process.
Aya, go ahead with your follow-up.
Is the province looking to set up a vaccination center or anything of the sort to meet with the demand?
As I said, we have more vaccine than we've ever had. We are comfortable that between our primary care providers and our pharmacists, that we have plenty of opportunity across the province for individuals looking to get a flu vaccine. They're all well aware of that. There's the potential for a significant increase in demand, and they're preparing to respond to that.
Next question will go to the Halifax Examiner's Tim Biscay.
Hi, Dr. Strang. This is all very heartening, the low numbers and the long period of time we're going without new positive cases until today, and that seems to be somewhat limited infection possibility. I wonder if as you look back, Nova Scotia early on adopted the travel restrictions, and it's been very successful. I'm reading literature elsewhere that is urging other locations to impose similar type restrictions, especially in the States. And those places that have them have lower numbers. I'm not suggesting that the other things should be downplayed, but I wonder if you have a new view on it. Do the restrictions reach to a higher level of urgency for you?
No, I think they play, as I said, there's three key main areas: restrictions, testing, and follow-up capacity, and then everybody in Nova Scotia, being COVID safe. It's those three together. So we always have had a view that we need the appropriate level of controls at the border. I'm not saying the border shut down, but we are careful about who gets in and then what actions they have to take, especially within the first 14 days when they're here. So that's an ongoing discussion that we have with certainly my colleagues in the other Atlantic provinces. It's a topic of national conversation, but certainly we need to. I think it is one of the things that has allowed Atlantic Canada to stand out, that we have had a measure of control over our borders that other provinces haven't had. But I will, other provinces provinces don't have the same capacity or the same, I guess, geography that allows them to have those kind of measures. It's much easier for us to talk about controlling our single airport and our land border and a couple of ferries, as opposed to if you look at Ontario with a large land border and multiple large airports, et cetera. So we're in a fortunate position, but border restrictions have to be part of our ongoing COVID approach.
Tim, go ahead with your follow-up.
Yeah, on the 50-person limit, especially in regards to sports, as I understand it, what you just said, groups of 50 in, I guess, what we call beer leagues of hockey, who regularly meet somewhere and they aren't an official league or whatever. They're just guys who do this all the time. They can have up to 50, but pickup sports can't. Now, my question is, I'm sure it's not the intent, but is there not a sort of inherent systemic racism element to that, where the white guys who play hockey can keep doing it, but the young kids in communities of color can't have, which is central to their identity and communities, can't have pickup basketball games?
So this isn't about color. I mean, there are lots of people, I just use hockey as an example. There are lots of people who book a gym once a week and play basketball. They can do that. They can have up to 50 doing that. What we're focusing on is the very spontaneous, just people just getting together to do something with no organization, no structure. That's, when we looked at it, that's the equivalent of a social activity that we have to apply the rule of 10 to that. It's got nothing, whatever's to do with race or skin color.
Next question will go to Kyle Shaw with the Coast.
Hi, thanks. Let's see. On the province's main COVID website, last week there was some reorganization of the main buttons for people to click to access important information. The button dedicated to reopening Nova Scotia was removed from the homepage, and a new button called How to Self-Isolate was added. So to me, that looks like a realization. The cases in the rest of Canada are fast increasing. We're not going to be able to drop the quarantine restriction anytime soon. We need to double down on making sure people know how to quarantine. This is my reading. Is that actually why the buttons were rearranged?
So I wasn't involved directly in what exactly communications did. That restructuring has been underway for a period of time. What happened last week was essentially we clarified for rotational workers, and we wanted to make it very clear for rotational workers as we changed the rules for them, allowing them to have a modified isolation. So we wanted to be very clear that people who were looking for information about how to isolate could easily find that on our website.
I wouldn't read too much into the change. If things change around the isolation and our restrictions around having to isolate coming into this province, Dr. Strang and I will do what we've been doing now for the last 6 months. We'll communicate directly with Nova Scotians about any change.
Go ahead with your follow-up, Kyle.
Thanks. Gotcha on that one, guys. About the second wave, is this increase in cases that we're seeing in the rest of Canada what you technically call a second wave, or is that really a surge from the first wave never quite dying out? And is Nova Scotia safe from a major second wave as long as we keep our travel restrictions and quarantine in place?
So I think we have to distinguish when scientifically, when people talk about a second wave, that's really a recurrence that's due mostly to the inherent nature of the virus. Some viruses have a very seasonal nature to them. It looks more and more that COVID doesn't have so much of a seasonal nature. I call it a resurgence. What we're seeing in Canada is we had a first wave and then a lull, and what we're seeing is a resurgence that is mostly due to human activities. We've made choices about reopening necessarily, but we're also seeing lots and lots of non-compliance and complacency with COVID-safe approaches and precautions. So it's the human activities and the human choices which are leading to this resurgence, which is very different from a second wave, which is inherently due to the nature of the virus itself. And I think that's important to understand that, because what it means is that we have a lot of ability to control how we will see more COVID, but how much we have and how much local spread there is very much in our hands as Nova Scotians, as I outlined earlier. It depends on what choices we collectively make and how willing we are to follow the requirements to keep each other safe by practicing all those preventive measures and sticking with small numbers in social gatherings, with not having large gatherings, sticking with masking. Those are the choices we can make to minimize any resurgence of COVID.
Next question will go to QCCR Radio, Ed Halverson. Ed, are you there? Moving on to CBC's Jean Laroche.
Hi there. Thanks for taking the question. Mine goes to Dr. Strang also, because Dr. Theresa Tam, your federal counterpart, made a point at the end of her COVID update that finished just before you came on, and she made a special plea to young people who, as the epidemiology is showing in other parts of the country, are kind of leading the way for some of the same reasons you talked about, non-compliance, getting together in larger groups. What's your take, Dr. Strang, on why we're not seeing that here, or are we not, is it happening here in the same way, and we just haven't, the testing hasn't caught up to it yet?
So I'm not sure if it's a testing issue. I think it's because I'm not naive. We've had I think, first of all, we have to recognize the large number of students, and by and large the compliance with the isolation and the restrictions that they had to follow, and kudos to all those students. But I'm not naive about that young people in general, social activity is a normal part of their life, and we're going to continue to remind them about how to have social life, but do that safely. But that inherently is going to have some risk. We're fortunate because I think we don't have COVID circulating locally. So what we have to do is minimize the chance of COVID being introduced, but knowing that it's likely to have more coming in. It's up to all of us, but especially, you're right, young people, that we have to understand that our social activities aren't just about us, that everything we do socially has the potential to put somebody else at risk and put our general communities at risk. I heard a very interesting conversation by an infectious disease physician on I'll say, CBC Radio this morning, and they were talking about on Ontario and Alberta, they haven't had an impact on hospitals, but they said yet. Because the real risk is that while most of the activity is in young people, it is starting to spread into other age groups. And inherently, as you get into older age groups, that's when you get more severe illness. So the message always comes back to everything we do is it creates a risk or protects people beyond ourselves and in our communities. So that's why I keep coming back to this is an opportunity for us to collectively care for each other. Especially in including young people who may not themselves be at really high risk of severe disease, although they could have severe disease. But if they're complacent, then they're putting everybody else at risk. So how do we support those young people and give them safe opportunities? But we also need to come together in all age groups and be willing to put some things aside, accept some restrictions on our activities for our collective good.
Jean, go ahead with your follow-up.
Yeah, my next question is for the Premier. Premier, as I understand it, the telehealth runs out at the end of this month, and we haven't heard an extension date yet. Can you tell us what's going to happen after in October in terms of telehealth?
There's ongoing conversations with doctors, Nova Scotian physicians. The Minister Delory and his team have been working with them. Quite honestly, Nova Scotians and patients have enjoyed this opportunity to use telehealth. There's never been a question that I don't believe it'll be extended. It may look differently, looking at what does it cover, those kinds of things. But it's it's certainly our goal to continue to provide this option to Nova Scotians as we go forward.
I'm going to circle back to Ed Halverson with QCCR Radio. Ed, are you there? And that's all the reporters we have for today.
Thank you, Chrissy. I've told everyone how proud I am of how the province has handled COVID-19, and I'm thankful to all Nova Scotians, to Dr. Strang and his incredible team at Public Health, and to our health leaders and those on the front lines for getting us to where we are today. And we wouldn't be here without them or all of you, and I thank you for following all the health protocols. To our business community, I know this hasn't been easy, but you are finding ways to innovate and operate dealing with COVID-19. Some might feel that we've overreacted with our restrictions. I want you to look around the country at other provinces. Their numbers are spiking again, and in some cases, they're even worse than before. This is a worry. If we don't believe there is a second wave coming, look outside of the Atlantic bubble. We are monitoring and preparing for a second wave that many of you might think isn't coming because of the way our numbers look here in Atlantic Canada. Science says otherwise. We cannot become complacent. We cannot stop following the protocols. They've gotten us to this point. We must wear a mask indoors in public places. I want to remind everyone that this is mandatory. We must keep our distance from those who are not within our own personal bubble. And of course, hand hygiene is essential. I'm not trying to frighten anyone here in our province, but this is a reality. COVID is not going away, and we need to be prepared for a second wave or resurgence. As your Premier, I will work with our Minister of Health and his department, Dr. Strang and his incredible team at Public Health, and we will do our part. I'm asking all of you to continue to do what you've been doing so that we can continue to not only lead this country, but quite frankly, be seen as one of the safest places around the world.
Thank you, Premier. I forgot. It's National Environmental Public Health Week this week, so I want to give a shout out to public health inspectors who are in Nova Scotia who are part of, as the Premier called, our incredible public health team. So thanks to my public health inspector friends.